Hi, I'm Cambria. I'm a student physical therapist here at the Adventist University of Health Sciences. Today, I'm going to be teaching you how to fit a wheelchair. There are 7 measurements to take to maximize comfort, safety, and accessibility. Let's head into the lab and I'll teach you how to do it. I'm going to walk you through all 7 measurements. The first measurement we're going to take is taken in supine to prevent an inaccurate reading. Sometimes if your patient is sitting, as I'll demonstrate, straight up, you need this measurement, which is going to be your seat depth. But if they're sacral sitting, slouching, then your measurement is going to be incorrect. So we're going to start here. Go ahead and lift your legs. Thank you. You're going to measure from the popliteal fossa down to the surface that they're laying on. Right here. Okay. Now you can go ahead and sit up. So continuing, we took our first measurement, now we have 6 more. So now we're going to measure our leg rest length. So here we start again at the popliteal fossa, and we'll go down. Can you flex your foot for me? We're going to go down to her heel, just like that. The next measurement will be her hip width. So this will be just a measurement of her hips from one side to the other. And on this measurement, be sure not to bend the measuring tape. Perfect. So moving on, our next measurements, you can relax your arms to your side. This will be the axilla to her seat, and this will determine how high you put the backrest. So we're going to start right in her axilla, down to the seating surface. The next measurement is similar, but will also help to determine backrest height. This is for her shoulder, the acromion process of her shoulder, down to the seating surface. Again, be sure not to bend the measuring tape. Keep it as straight as possible. And the final measurement, which will determine the headrest height, is the top of her head down to the seating surface. And the final measurement will be to determine the height of your armrest. So with her elbow flexed at 90 degrees, I'm going to measure from her olecranon process of her elbow, again, to the seating surface. Now that you've taken all of your measurements, I'm going to teach you how to adjust those measurements to give to the wheelchair company to have their chair manufactured. So starting with the supine measurement that we took for seat depth, you're going to subtract 2 to allow clearance for her legs to move here. And for her seat width, which is this way, you're going to add 1 to 2 to allow clearance for her to sit down. For the seat to floor height, you're going to measure here and you add 2. For the seat back height, axilla to surface, you will subtract 4. And finally, for her armrest, you will add 1 inch. When adjusting your measurements, be sure to consider if your patient is sitting on a cushion. Be sure to add the compressed cushion height to the leg rest height, the armrest height, and the seat back height. So now that we've taken all of our measurements, we need to verify that the fit is correct for this patient. So taking 2 fingers, which approximates 1 to 2 inches, you're going to use this as a guide to verify all of the different points on your chair are correct. So starting with the seat width, take your 2 fingers and make sure that there's at least that much clearance on each side of the chair so that her hips don't get compressed by the armrests. Moving down, doing the 2-finger test underneath the popliteal fossa here, making sure that there's enough room where the seat rest is not pushing up against her calf. Next verification we'll do is right in her axilla. Unfortunately, this chair is not correct, but you'll put the 2-finger test right here to make sure that there's enough clearance for her to propel the chair. We're going to take 2 fingers and put them just under her distal thigh. Make sure that your fingers can slide in easily. And the last measure is your leg rest height. You'll take 2 fingers and make sure that there's at least that much room between her leg rest and the floor. Doing these measurements correctly is important for your patient's comfort, safety, and long-term health. There have been multiple studies that prove this to be true. One done in Taiwan showed that the postural improvements actually improved anterior and posterior head tilt of the patient. Another done by Fernandez showed that appropriate fit actually improved the quality of life because it improved the accessibility of the patient while using the wheelchair. A third, done by Sprigle, showed that it would protect skin integrity when the wheelchair fit appropriately. This is especially true when it comes to seat depth. If the patient is slouching, as I said previously, there will be too much pressure on the sacral tuberosities, which can lead to skin sores. Thank you for watching this video on how to fit a wheelchair for your patient. Bye! This is especially true when it comes to seat. Are you kidding me?